Is it okay if I keep looking at him? Because looking at there is really awkward.
Yeah.
Hi there, my name is Liam McGinley. I'm a physiotherapist and clinic manager at Physioactive. I work in our Camden Medical Centre branch. I've been working as a physiotherapist for 10 years. I'm originally from Ireland, having studied my degree there. I did my master's in the United Kingdom, and I've been working in Singapore for the last 9 years.
Hi, I'm Vanessa. I'm a physiotherapist. I'm Singaporean. I studied over in Australia and I worked there for a little over 3 years. I just recently moved back to Singapore. So today we're just going to be answering a few of your questions about physiotherapy.
What is physiotherapy, and are physios doctors? No, we are not medical doctors. We are trained as allied healthcare professionals. To complicate things a little bit further, some physiotherapists can go on to become doctors, but it would be by studying for their PhD. So generally they would work in a research-based setting rather than in a clinical setting.
Yeah, actually a lot of my lecturers in uni were all PhDs.
What are the daily challenges at work faced as a physiotherapist? Sometimes it can be quite difficult to keep your patients motivated, particularly if they're struggling to see some progress that they're making, and also if they're in lots of pain. So sometimes that can be a bit of a challenge, but we do our best to keep them motivated and positive and keep them on the path to recovery.
Right, my turn, let's go. What is the most common misconception about being a physiotherapist? Okay, so this one, a lot of people think that we're just masseuse, that we give a good massage and then we send people off on their way. We can do a lot more than that. Okay, let's go on to the next one. How should I go for my physiotherapy appointment? So I would say to come in comfortable clothes or come in clothes that you're going to exercise in, work out in. For anyone who's coming in for a neck or a shoulder injury, if you're not comfortable with taking your top off, then I'd say to bring in a tank top as well.
Oh, this is a tricky one. What is the difference between a physiotherapist, an occupational therapist, a chiropractor, or a sports massage therapist?
Ooh, good question.
That is a more tricky one. Okay, we'll start with the physiotherapist. So as physios, we're more familiar with that profession. We generally will treat multiple areas of the body, and we usually treat with a combination of manual therapy, of exercise prescription, and also using some electrotherapy. Occupational therapists, it can depend on the setting that they're working in. In a hospital, it can be quite different to private practice. In private practice, sometimes they will specialize and treat in like repetitive strain injuries or injuries to the hand, so they might be employed as hand therapists. Chiropractors will generally treat spinal conditions, and that might be more related to manual therapy. However, some may also use a little bit of exercise therapy. And a sports massage therapist typically will just utilize massage. Physios will generally treat multiple areas of the body. Chiropractors would generally specialize in neck and back pain. An occupational therapist might specialize in hand injuries. And a sports massage therapist, less relevant if you've had an acute injury, would be probably more relevant if you're having maybe a little bit of muscle ache or a little bit of soreness after you've had some activity or played sports.
All right, so for our next question. So, how does physiotherapy help recovery? Is it not better to rest? How long after an acute injury to wait before seeing a physio? So I'm gonna go through this one by one. How does physiotherapy help recovery? So I would say that we guide people back to their sporting goals as quickly and as safely as possible. And to rest, it's definitely good to rest, but the term is relative rest. You want to rest enough, but not too much. And how long after an acute injury to wait before seeing a physio? I would actually say to get in early. You want to make sure that it's nothing that has to be escalated, nothing that's time sensitive. Most of the time it's not. And then if it's not, you can just get a good plan on how to get back to your sporting goals as quickly as possible. What do you think about this one?
Yeah, so I would agree. Some rest is definitely good, but sometimes people need a little bit of advice on how much rest, because too much rest sometimes isn't good, and at the same time too little rest isn't good. And as Vanessa said, some injuries are a little bit time sensitive, so it's important that we actually act on them straight away. If an injury is very serious, sometimes it can be the case that they actually might need a little intervention. It could be imaging, or in worst case scenario, it might be an urgent surgery, and it would be something that we wouldn't want to miss. What are some of the common sports injuries you see? Okay, so we would see a combination of different types of injuries. So some might be acute injuries. An example of that might be like an ankle sprain, and that could be in sports such as basketball or badminton. We could have maybe some contact injuries, so maybe like a shoulder ligament sprain if someone's playing rugby or a contact sport of that nature. We would often see a lot of repetitive injuries, so like overload injuries, and that could be in sports such as running or cycling or more endurance-based sports. And then sometimes we will see injuries of the nature that would require surgery, and that could be like an ACL, a knee ligament injury. And that could be after maybe soccer, which is the most popular sport that we would probably see, and also some seasonal sports such as skiing. What are some common physiotherapy treatment methods and techniques used for injuries? Do you want to take that to start with?
Well, I'd say firstly rest, advice, and pain management from the start for anything too acute.
After that, our treatment normally involves a combination of things, and that could be some manual therapy. So that could be some massage, some deep tissue work, some mobilizations of joints. It could also involve, generally will also involve some range of motion exercises, some exercise prescription, including some maybe strengthening and some stability exercises. And then sometimes our treatments will also include some use of electrotherapies.
All right, our next one. How long does physiotherapy last? What happens if I drop out of physiotherapy earlier than prescribed because I'm feeling better? Okay, so how long physiotherapy lasts, that really depends on your injury, the severity of your injury, and what your goals are, what you're trying to achieve from physiotherapy. And the next one, even if you're feeling better, so this is what we always tell our patients, even if you're feeling better, it doesn't necessarily mean that you're better. What we always want to do is get someone out of the door much, much stronger than when they walked in.
Yeah, no, I would generally agree with that. What are some common problems faced by women after childbirth that can be addressed by physiotherapy? I think that might be more appropriate for you to handle, Vanessa.
All right, so I'll talk about this. So there are some common problems out there. Not every woman will experience them. So there's going to be things like back pain, sciatic nerve pain, sacroiliac joint pain. You have your incontinence, your diastasis recti, which is going to be the abdominal separation, and sometimes you also get those wrist injuries like carpal tunnel and de Quervain veins. Let's go on to the next one then. This looks like another women's health one. Should I take it?
I'll let you have it.
All right. So in what way can women strengthen their bodies to limit problems that can arise from childbirth? So ways that women can do this, going for a pelvic floor assessment. You can also go for pelvic floor and core training, or just to get it a bit stronger. There's also some prenatal Pilates that you can do to get your joint stabilizers nice and strong. Going for a pregnancy massage would be another one, just to make sure that your body is feeling nice and happy, or your muscles are nice and happy as your body is trying to accommodate this change that it's going through. And definitely go in for a physio appointment. If you already have any existing injuries, any existing pains, just get it fixed before anything else.
Yeah, as Vanessa said, physiotherapy could definitely help you if you're pregnant, and it can prevent things from worsening. How has working from home affected people in recent years? Do you see more people with issues relating to poor ergonomics while working from home? Definitely. We've definitely seen a big spike in people presenting with neck and back related pain. It's something probably because working from home generally means for most people a less ideal ergonomic setup. It generally means moving around, walking less, so kind of a reduced step count. And we've definitely seen that contribute to more cases presenting to our clinics. How does physiotherapy play a role in supporting the workforce regarding ergonomics? Well, we at Physioactive offer services such as ergonomic workstation assessments. So we could either do an assessment at someone's home or in their workplace to see if we can improve their work setup. We also hold talks, which can be done virtually or in person, again, where we could provide ergonomic advice on people improving their setup. And this can then help to reduce the risk of neck, back, elbow, and wrist pain.
All right, the next one. It's another ergonomic one. What are some easy tips that one can incorporate into their work from home routine to reduce the risk of neck or back injuries? So like Liam said, getting the ideal setup. You can also move around a bit more, but if you want to be a bit more specific, definitely start getting into some neck and back stretches or mobility. That's the last one. Shall I take it?
I'll let you have it.
All right. Okay. How do you think employers can better support their employees when they work from home? So ideally, get an ergonomic assessment, get an ergonomic talk for your employees so that they know how to best set up their workplace environment as ideally as possible, or as close to ideal as they can get it. Also, have little set breaks throughout the day so that they can move around a bit more. And another one, facilitate some audio meetings so that the employees can walk around a little bit more and just move around a bit more during their day.
Yeah, we know that sometimes back-to-back Zoom calls can be an issue. So trying to get a little break in there, as Vanessa said, can be really helpful. And walking meetings is definitely something we would encourage, so definitely a fan of those. We've really enjoyed answering your questions today.
And if you have any other questions, please let us know in the comments down below.
If you want some more information about our services, please look us up at Physioactive SG.
And please remember to like and subscribe to Medical Channel Asia.
Bye-bye.
Don't forget to like, comment, and subscribe for your regular dose of Asian health information.